adjust it, make sure. Okay.
Good. Just a few weeks ago, we as a country witnessed some history. The political tides have changed in Congress. One party has taken over another political party. And usually around this time of year, we see a lot of debates and a lot of issues thrown across the table. Probably, arguably, the number one issue around this time is healthcare. Why is healthcare costs rising so much? It's quite ridiculous. They increase year after year. Hello, my name is Eduardo Riggs, and today I'm going to be discussing the costs of healthcare and why they increase so much, but more specifically in the area of medical malpractice premiums. So I'm going to be addressing medical malpractice premiums in two ways. But before I do that, I'm going to explain exactly what medical malpractice premiums are. So first, what are medical malpractice premiums? You see, every year a doctor will pay what is called a premium to an insurance company just in case he makes a mistake. So, say for example, a doctor performs a surgery and he was supposed to perform a surgery on the left leg, but then accidentally does it on the right leg. So he gets sued and goes to court and he loses the lawsuit. So he has to pay a settlement. But because he was paying a premium or a fee to an insurance company, he's not the one paying the settlement. Rather, it is the insurance company that was covering for that settlement. So the insurance company paid for that settlement. So again, an insurance premium is when a doctor pays the insurance company a fee every year. So a medical malpractice premium is more specifically where the doctor pays a certain amount of money to an insurance so that just in case he messes up in the surgery, he's not the one paying for a settlement. So in the last several decades, we've seen increases in the costs of healthcare, and we've also seen increases in these medical malpractice premiums. Is there a correlation between the two? Is the cost of healthcare attributable to the fact that medical malpractice premiums are also rising? So I'm going to address this in two ways. Number one, do medical malpractice premiums increase the cost of healthcare? And number two, do medical malpractice premiums damage? Do they damage the provision of healthcare? So number one, do they increase the cost of healthcare? Well, the answer is not really straightforward. It's more of a yes or no. In fact, it's more of a it depends where you live. You see, each state in this country has their own laws and their own way of doing things. So one state may be very much different in the way they do things than another state. So there are three factors that you can think of when it comes to medical malpractice premiums. Number one, the legal environment. Number two, the political environment. And number three, the quality of healthcare. So California, they have a lot more people living in that state than New York. But California has a lot more laws when it comes to the amount a settlement can be paid out to. So New York is much different in those kind of laws. So in the state of California, in 1 year, California will pay $180 million in medical malpractice, whereas New York will pay over $660 million in medical malpractice. So it just really depends on the legal environment. And also, secondly, the political environment. What it really boils down to is what the judge thinks, and also what the jury thinks as well. So you can have a lot of laws saying about doing this and that, and this is how much you can have for a settlement, but what it boils down to in the end is what the judge thinks. So you have the legal environment, the political environment, also the quality of care. You may live in a county or a parish where the quality of care is actually pretty bad. In a lot of states, in fact, most states across this country, the number of claims for medical malpractice can be attributable to maybe 1, 2, or even 3% of the doctors that practice in that state. So it just really depends on where you are. Some premiums are much higher in some other states, And in some other states, like California, for example, premiums are low. So depending on where you live, those premiums can be high, and therefore your cost of healthcare can be higher than other states. So this leads me to my second question. Do these rising costs of premiums affect the provision of care? Well, you see, in the overall scope of things, the increase in cost of premiums, they really have a small effect on the increase of healthcare. That's why a lot of people really try to ignore this issue of medical malpractice premiums. Studies show that small increases in medical malpractice premiums only lead to small increases of healthcare costs. But in some way, they can actually have a negative effect on the provision of care, especially in rural economies, areas where they're kind of hard to find a McDonald's, basically. So studies have shown, especially from a study from the National Bureau of Economic Research, have said that a 10% increase in those medical malpractice premiums can lead to a 1% decrease in the number of physicians in that area. So when medical malpractice premiums rise, doctors are forced to leave because they can't pay for those kind of costs. So in the end, when we look at medical malpractice premiums and their effect on healthcare costs, increases in premiums can only lead to small increases in the cost of healthcare. But when it comes to rural economies, a lot of times when we see those increases in premiums, they can affect the number of physicians in that area and can hurt the number of physicians in that area. So, when looking at medical malpractice premiums, we still should address the issue. Even though some consider it to not be a major factor, we still should address it. Try to tame these premiums from increasing year after year so that we can ensure the quality of care at a good price. Thank you.